Good morning, students. Today's lesson will be on Introduction to Epidemiology. Okay, first we will learn what is epidemiology. Epidemiology, the term epidemiology was coined from Greek words. Epi means upon, demos means people, and logos means study. So epidemiology means the study upon the people, referring to the study of diseases that affect population. The term epidemiology was first coined by Spanish physician Dr. Joaquin de Villalba in 1802 in his famous book Epidemiologia Espanola. Now we can go through the definition of epidemiology. The definition given by John M. Last in his Dictionary of Epidemiology was like this. Epidemiology is the study of distribution and determinants of health-related states or events in specified population and the application of this study to the control of health problems. The definition given by World Health Organization is like this. Epidemiology is the study of distribution and determinants of health-related states or events, including disease, and the application of this study to the prevention and control of diseases and other health problems. Epidemiology is very important for biomedical science students. It bridges the lab research findings and the population health. It helps the student to understand that how his or her laboratory research findings can be applied to the population health. Helps in understanding disease patterns in the population. What is the prevalence of disease? Prevalence means how many people are affected by the disease at that point of time. What is the incidence of disease? How many people are newly getting the disease? What is the trend of disease? Is it going up or going down? Positive trend or negative trend? Okay. And is there any epidemic? Epidemic means sudden occurrence of a huge number of cases, more than the expected frequency. Endemic. Endemic means occurrence of disease in a localized area, constant occurrence in localized area. Okay, all these we can understand by studying epidemiology. Epidemiology develops data analysis and interpretation skills among students. Okay, epidemiology supports evidence-based research. Okay, helps to explore the current best evidence available, and it helps the student to critically evaluate the evidence. Real world applications. Okay, so students get an idea how he or she can apply his knowledge in real world situation, like outbreak investigation or devising a screening program, applying a screening program in the community. Screening is the identification of diseases in a community which is not having any symptoms. So apparently healthy communities. We are looking for the development of disease in the apparently healthy community. That is screening programs. Interdisciplinary collaboration. Okay, so students apply his or her knowledge in a team or with epidemiologists, clinicians, and public health teams, and it develops teamwork. There are so many historical milestones in epidemiology. We will go through a few of this. Hippocrates. Hippocrates is known as the father of medicine. He lived in around 400 BC. Okay, Hippocrates suggested that diseases were influenced by various environmental factors, diet, and a lifestyle. In that time itself, he identified that. And he identified that diseases are not due to supernatural causes. It is due to the factors in our environment, diet, and a lifestyle. He was a great physician who had a who thought about the causation of disease and um, suggested the role of environmental factors, diet and lifestyle. Another historical milestone in epidemiology is the findings of John Snow in 1854. Okay, John Snow was known as the father of modern epidemiology. Okay, during his time there was a cholera outbreak. Okay, and he used spot map, and linked the uh, relationship between the cases and their environment. Okay, first spot map was created by John Snow. His investigation confirmed that contaminated water from the Broad Street pump was the source of cholera epidemic. And consequently, the removal of the handle led to cessation of the epidemic. At that time, nobody was knowing that um, cholera was due to a um, microorganism and it was spreading through water. Using the spot map, Jon Snow was able to identify that more number of cases and deaths were around a pump of water, that is Broad Street. Okay, then he suggested that there may be some relationship between cholera outbreak and drinking water. Then he removed the handle of the Broad Street pump that led to reduction in the number of cases. This is John Snow. He was an anesthetist and he applied his investigative mind to control the epidemic. Okay, this is a spot map of um, Broad Street, and more number of cases and deaths were around Broad Street pump. Okay, this is a replica of Broad Street pump, which is kept in the memory of John Snow. Okay. Another historical milestone in epidemiology is Framingham Heart Study, which started in 1948. It is a landmark longitudinal cohort study launched in the US to understand various cardiovascular disease risk factors, influencing decades of prevention strategies. Okay, it was started in 1948. Each year, more and more risk factors are added to the Framingham Heart Study. It helped us to identify the major risk factors of heart disease. Still continuing, providing crucial insights into risk factors, disease progression, and the prevention of heart disease, stroke, and other related conditions. Okay. In 2023, Framingham Hut study completed 75 years. Another historical milestone in epidemiology is smallpox eradication. The success of the smallpox eradication program with vaccination was a significant achievement in global public health, demonstrating the effectiveness of vaccination and various public health interventions. These were the strategies for smallpox eradication, mass vaccination, and strict surveillance with containment measures. Vaccination aimed to reach at least 80% of the population, while surveillance systems were established to quickly detect and isolate all the cases, preventing further spread. This led to smallpox eradication in the year 1980. Okay, another historical milestone in epidemiology is identification of HIV as the cause of AIDS. HIV is human immunodeficiency virus and AIDS is acquired immune deficiency syndrome. Through epidemiologic investigations, human immunodeficiency virus was identified as the cause of AIDS. It revolutionized infectious disease surveillance and response. This is the human immunodeficiency virus. Epidemiologic investigation helps in developing antiretroviral treatment regimes for HIV. Okay, now we can go through the core functions of epidemiology. Surveillance. Surveillance is a core function of epidemiology. Surveillance means continuous and systematic collection, analysis, and interpretation of health data. Okay, example, all of us know during COVID-19 time, tracking of COVID-19 cases were done using collection, analysis, and interpretation of health data. That is surveillance. Okay, now we can go through various surveillance systems. Okay, infectious diseases surveillance system is there, chronic disease surveillance, injury surveillance system, cancer surveillance system is there, cancer registry is there. So they're constantly looking at the cancer cases and the risk factors. Health service uptake. Okay, health service uptake is a surveillance system. So in some countries, people are having negative impression about health services. So that can affect the health badly. Vector distribution surveillance system that can identify newer vector population in a community and can take action against vectors. Vectors are disease transmitting agents like mosquitoes and other insects. So vector distribution surveillance system will identify the emergence of new vector population in the community. So it can help in controlling the vector-borne diseases like dengue, malaria, filariasis, or environmental hazards surveillance system. That will one example is air quality index. So we can through the surveillance of air quality index, we can identify air pollution early and can take preventive measures. Environmental hazard surveillance system surveillance. Okay. Another core function of epidemiology is field epidemiological investigations. Investigation of unexpected outcomes of uh, health events or health problems. Okay, is done under field epidemiological investigation. Example, during outbreak investigations. Now we can go through the steps in a foodborne outbreak investigation. First is detect. Okay, first step is detect. Detect a possible outbreak through public health surveillance. That's the first one. Second step in outbreak investigation is find more cases in the outbreak. Search for more cases. Then third step is generate. Generate hypothesis through interview with sick people. So we have to go and see each of the affected people and their community and generate hypothesis through interviews with the sick people. Then fourth step is actually test. Testing of hypothesis to find a likely source for the infection. If no source is found and cases continue, return to step 3. So, if no cause or no source is found means you have to generate hypothesis again through interview with the sick people and the people around the sick people. Okay, then test the hypothesis using statistical test. Which hypothesis can be the cause for the outbreak? Next step is solve. Solve source of the outbreak and ultimate point of contamination. Identify the point of contamination in a foodborne outbreak investigation and correct it or stop the spread. Then comes control. Control outbreak through recalls, facility improvements, and industry collaboration. And sometimes in countries like Malaysia, we can stop the restaurant or food premise till the contamination is over, till they correct it. Okay. Then seventh one is decide. Decide an outbreak is over and the public is no longer at risk. If cases go up again, continue or restart the investigation. Another core function of epidemiology is conduct descriptive studies. Okay, descriptive epidemiological study is those type of study. Okay, which study the disease occurrence in terms of clinical manifestations, what happened, time, when it occurred, place, where the disease occurred, person, who got affected. So, study the disease occurrence in terms of clinical manifestations, time, place, and a person. Okay, what means clinical manifestation of the disease? Who means who are affected? Where the disease occur? When the disease occur? So, if we are describing all these factors, it is known as descriptive epidemiological studies. Examples are case reports, case series, and a cross-sectional descriptive studies. Conduct analytical studies. Okay. Study the disease occurrence in terms of causes, risk factor, and the mode of transmission of disease. Okay. What are the causes of disease, risk factors of disease, factors associated with the disease occurrence, and the modes of transmission of disease? All these come under analytical studies. Why or how? Causes, risk factors, modes of transmission. Okay, so we are getting the answer why the disease occurred, how the disease occurred. Examples of analytical epidemiological studies are case control study, cohort study, and ecological study. In coming session, we will go in detail about case control, cohort, and ecological studies. Another core function of epidemiology is evaluation of health programs. Okay, epidemiology helps in assessing the effectiveness and efficiency of various health programs. For example, you can see evaluation of immunization campaigns or immunization programs. Okay. Okay, these are the inputs required for evaluation of health program. Okay, inputs for the immunization campaign are availability of vaccines, quality of vaccines, services delivered. Okay, through vaccination program, advocacy, how much advocacy uh, or support was given for the vaccination program from various people. Planning, was the planning done correctly or not? Was the training for all the staff and people involved in vaccination program was done correctly? Okay. Outcome. What is the outcome of vaccination program? Immediate outcome will be increase in vaccination coverage. More people taking the vaccine. That is the outcome. Impact. Impact of this program in the community. Okay. Short-term impact is like that. Reduces vaccine preventable disease burden in the community. So vaccine preventable diseases are there like diphtheria, pertussis, tetanus, polio, okay, hepatitis B. All these are vaccine preventable diseases. Tuberculosis is also a vaccine preventable disease. Okay, reduce the vaccine preventable disease occurrence in the community. Okay, that's the short-term impact of the program. What is the long-term impact of the program? Reduce infant and child morbidity and mortality. Another core function of epidemiology is intersectoral coordination. It means working with other health professionals and disciplines. Okay. There are so many other departments involved which can lead to, which can influence the health of people, like food safety department, animal health department, and public health. Okay, these all work together. There is an intersectoral coordination. Okay, so what are the components of that? Effective intra and intersectoral communication. We should communicate with the other sectors, giving respect and value and listening to them. Okay, that's a effective intra and intersectoral communication. Second is political and organizational willingness and commitment. That is the second component of intersectoral coordination. Third is sector roles and responsibilities should be defined. Okay, if rabies is a big problem, okay, there should be intersectoral coordination between public health and animal health so that sector roles and responsibilities, what all activities will be done by public health department, vaccination of humans will be done by public health department. Animal health means vaccination of animals will be done by animal health department. There will be intersectoral intervention team should be there. Okay. In case of foodborne infection, food safety department and public health will work together. Data sharing. Okay. There should be integrated surveillance system also. Okay. That will help in communication between one sector with other. Another core function of epidemiology is health policy development. Using epidemiologic data to guide health policies and public health actions. Okay, there are so many components in evidence-informed policy making. So, based on the current best evidence only, policy are made. First is knowledge translation. Knowledge. We have to, as a public health person, we have to inform the policy makers about the correct knowledge, available best knowledge or best evidence. Health technology assessment. Okay, is the technological part is uh, adequate or not? Guideline development and adaptation. As a public health person, we have to help in developing guidelines, routine data, and health information system. So, public health people will be analyzing the data and giving the information and interpretation of the data to the policymaker. National surveys. There are so many national surveys. In Malaysia, there is National Health and Mobility Survey that is done by Institute of Health Research and epidemiologists. Epidemiologists are doing national level surveys, and the findings of that survey will be communicated to the policymaker, which can help in policy development and public health action. Ad hoc studies, monitoring and evaluation. There are so many other studies. The findings of those studies will be published in journals, and that will be used for health policy development. Now we will go through uses of epidemiology, exploring the distribution of disease. Okay, epidemiology is the study of disease occurrence in terms of clinical manifestation, what happened, time, when the disease occurred, place, in which geographic area the disease occurred, person, who are the persons who got affected. Distribution of disease in terms of time, that is tracking disease trends. Okay, epidemic curve is drawn. Okay, time is uh, shown in x-axis and the number of patients in y-axis. So we can see one epidemic curve. Okay, month of onset is uh, shown in x-axis and the number of people who are affected shown in y-axis. Okay, cases of an unknown disease by month of onset. This is an example of epidemic curve. Epidemic curve will help us understand the trend of disease in terms of uh, time, that is tracking of disease trends. Distribution of disease in terms of place or distribution of disease in terms of geographic area. So, epidemiologists prepare spot maps which visually represent the geographic distribution of disease cases or other events. Spot maps help epidemiologists quickly identify clusters or patterns of illness that might not be evident from simply looking at numerical data. Okay, this diagram shows spot map. Okay, laboratory confirmed cases of West Nile virus disease in New York City. Okay, it shows the clustering of cases in which area clustering is more. Okay, In this case, some clustering is there near the water source. Okay, so that shows there may be some vector population there, or it can help us to understand the possible risk factors of the disease. Distribution of disease in terms of person. Okay, look at this. It is a prevalence of ischemic heart disease. All of us know that ischemic heart disease is more common among males. Okay, compared to females. Because females up to the age of 55 years, they are getting some protection from estrogen. After menopause, after the age of menopause, the ischemic heart disease occurrence in among females also increases. Okay. Distribution of ischemic heart disease according to age and gender. As age advances, ischemic heart disease occurrence increases. Now we can go through the next use of epidemiology. Epidemiology helps in identification of causes and risk factors of disease. There are so many risk factors for a disease. For example, for ischemic heart disease, there are many risk factors. Some are known as non-modifiable risk factors, those risk factors which cannot be modified. Okay, some risk factors are modifiable risk factors, which can be modified according to lifestyle changes and exercise. Okay, non-modifiable risk factors are, first one is age, more than 45 years in men and more than 55 years in women. In the previous slide we discussed, no, up to the age of 55 years, women are having some protection because of the presence of estrogen. Men have higher risk of developing ischemic heart disease. Family history of premature heart disease. Those with a family history of heart disease will have higher risk of development of ischemic heart disease. Certain ethnic groups, such as South Asians, have higher risk. Okay, now we can go through modifiable risk factors. Okay, these are the modifiable risk factors: hypertension, high levels of LDL cholesterol, high levels of triglycerides, low levels of HDL cholesterol. HDL cholesterol is heart-friendly cholesterol. Okay, so low level of HDL cholesterol is a risk for development of ischemic heart disease. Presence of diabetes mellitus or increased fasting glucose levels. Smoking. Smoking is a risk factor, modifiable risk factor. Obesity and overweight is a modifiable risk factor. Physical inactivity. Sitting more time. Okay, that is also a modifiable risk factor. Excess alcohol intake and levels of stress is also a modifiable risk factor. Another use of epidemiology is understanding the progression of disease from exposure to a risk factor to the disease outcome. Okay, how the disease progresses from the exposure to risk factor to the outcome. Describing the natural history of disease. What is natural history of disease? It is the progression of disease in a natural way in a person in the absence of any intervention. Is is a progression of a disease in an individual over time without any medical intervention. Okay, this is the diagrammatic representation. Okay, initial stage, there will be stage of susceptibility. Stage of susceptibility of developing disease. Okay, stage of susceptibility to get exposure to risk factor. At that time, person get exposure to risk factor. Then there is stage of subclinical disease. What is subclinical disease? Disease process started, but no symptoms appear. Okay, there are some pathologic changes, there are some biochemical changes taking place during the stage of subclinical disease. Then slowly onset of symptoms starts. Okay, symptoms start. At the initial part, patient or person will not recognize the symptoms. Okay, after some time only he get diagnosed. Okay, usual time of diagnosis will be slightly after the onset of symptoms. Okay, that is known as the stage of clinical disease. Then, if person is not getting detected or diagnosed during the stage of clinical disease, he goes to the next stage, that is known as late pathogenesis. That is stage of recovery, disability or death. Okay, in late pathogenesis phase, person may develop complications, person may get disability or death. Understand? This is a natural history of disease. When the person is not getting any intervention, the disease progresses from stage of susceptibility to stage of subclinical disease. Then it moves to stage of clinical disease. Then it goes to late pathogenesis, that is stage of recovery, disability or death. Next important use of epidemiology is evaluation of various clinical, surgical or community-based intervention. Checking whether treatments or prevention programs are working by analyzing the data. Okay, if the treatment is effective means uh, disease will be reducing. Okay, prevention program is effective means uh, we are able to prevent the preventable diseases. Okay, assessing effectiveness of interventions and how well it's being implemented. Evaluation is crucial for identifying what works, what doesn't work, and how interventions can be improved. Thank you.